Alrighty. Hey everyone, my name is Ayush. I'm currently the head of the Parent Outreach Committee in Catalyst, and I'm super excited to be here with you all today as we discuss mental health and substance use, and more importantly, the correlation between the two. So over the past year, mental health has come to the forefront of discussion and is an increasingly prevalent topic amongst teens. Additionally, we've seen an increasing trend in substance use, and it is therefore important for us to recognize and understand why there is in fact a correlation between mental health and substance use so that we can support those students who do need help. Before we get into the panel itself, we'd like to share a brief presentation with you all to help give background information and insight as to why it is in fact necessary to be talking about this topic. If at any point throughout the presentation you have any questions whatsoever, please do not hesitate to put them in the chat, as we will have a live Q&A session at the end of the panel based on questions we receive from you all in the Facebook live chat. With that being said, we are now going to get started by discussing the current mental health trends.
Over the last few years, the focus on mental health struggles, especially within youth, has increased exponentially, with it being one of the most spotlighted topics for youth activism and overall public awareness. As you all can see, based on the infographic shared, many kids and young adults experience some sort of mental health issue throughout the course of their adolescence, with these statistics being solely based on diagnosed and reported cases of mental health problems. It is important that we recognize that the numbers can be higher than what we see here, because there are many students who don't talk about the struggles and simply don't share their experiences with others, even with their close family and friends. Understanding the severity of the data presented illustrates just how important it is to talk about mental health publicly, which is why we chose to hold this event today.
Now let's take a look at current substance use trends amongst teenagers and young adults. As you all can see, there have been an increasing trend in the use of many substances across all ages, specifically illicit drugs, alcohol, and vaping, for nicotine, marijuana, and flavored products. With this study, it's important to understand that the data is not complete because the National Institute of Drug Abuse has not fully completed their surveying of participants due to the COVID-19 outbreak. With that said, the trends are still alarming and indicate that substance usage amongst young adults is very, very high. For example, about 40% of 10th graders and 55% of 12th graders had consumed alcohol at least once in the year before the study concluded. In addition, 34% of 10th graders and 39% of 12th graders reported that they had vaped at least once in the year before the study had concluded. With numbers like these, it's even more important for us to understand why so many students use substances regularly, as learning about these causes will enable us to have a more informed approach to substance use prevention as a whole.
So now that we've discussed how prevalent mental health and substance use issues are amongst young adults, it's important that we shift our focus to our main topic of the night. How does substance use and mental health correlate with one another? Oftentimes, students who are under severe stress, anxiety, or depression will turn to substances to help deal with their issues. As we'll discuss on the next slide, there are many reasons that young adults look to substances as a coping tool for their mental health issues, and it is important that, with the proper education, we help discourage and remove the appeal from substances, being the fix to many individuals' mental health issues.
Some of the most common misconceptions about substances are that they can help with sleeping, relieving anxiety, and dealing with some traumatic experiences. And as a community, it's important to us that we help students who are under this impression learn that whether these assumptions are true or not, they don't come without serious damages and repercussions to the body and the brain. And there are also countless alternatives to using substances and dealing with mental health issues.
So what can you all do as parents to help? Well, for starters, simply being here is a great first step. Being educated and aware about the different struggles and circumstances that many students face has a crucial role in helping out individuals who do suffer from the problems that we have discussed and will continue to discuss throughout the night. Seeking help from professionals in the field being extremely patient and understanding with your student, simply having genuine conversations with your students to check in on them regularly and offer support are the best ways that you all as parents can help your students make the safest and most educated choices while ensuring that their emotional and mental well-being is still looked after.
All right, thank you so much. That was from our parent outreach committee of Catalyst. And so now we're going to move on to the panel portion of our evening. And so we have some incredible panelists joining us tonight. As I share your name, will you just say hello so people can see your face? That would be great. First, we have Dr. Susan Sirota. She is a pediatrician at Pediatric Partners and a founding member of Stand Strong Coalition and chairs our marijuana committee. Then we have Carson Uzel, the current president of our Catalyst Club. Then we have Maham Sheikh, head of Digital Platforms Committee. And then we have Aritra Bera, who will be joining us from a tennis match shortly, member of the Parent Outreach Committee, and then Maya Gopal, the head of the Policy and Legislation Committee and Catalyst president for the next year, 2021-2022. So we're stacked with some outstanding panelists this evening, and they're really excited to share their perspectives with you. And so as we are talking, please feel free to ask questions in the Facebook chat, and we'll be excited to answer them during the panel. And I'm going to kick it over to Ayush.
All right. So now we're going to get started with the panel and the questions itself. The way this is going to work is we'll ask a question and then we'll turn it over to the panelists for them to provide their own insights and perspectives. And just kind of talk about what they think in regards to the topics that we're talking about today. So without further ado, the first question is going to be, what are some signs that a student is going through mental health struggles?
Okay, I can take that one. And to start, thank you everyone for being here tonight. And to introduce myself further, I'm Carson again. I'm the current president of Catalyst for the 2020-2021 school year. So I'm currently a senior at Stevenson. And in terms of signs that a student might be going through mental health struggles, I think there are a few obvious ones that people talk about all the time. Grades going down, students doing their work less, sleeping like either a lot or very little, and just being like demotivated in general, not hanging out with friends as much, dropping off from clubs and sports. But in addition to like, I guess like quantifiable changes like that, it's also important just to track students' motivation over time, because if a student seems like they're not as motivated to do their work, if they're complaining more about the work that they're doing, or they just don't seem as invested in a particular club or a particular sport, that could be a sign that they're just not enjoying how they're spending their time as much. And that might be a sign of like a mental health issue that could be going on. And on the flip side of that, I think another sign of mental health issues could be that a student is overexerting themselves. Maybe they're doing a lot of clubs, or they're very invested in sports, and if they're like very invested in it and they're not seeing the progress that they want, or they don't have a lot of time to spend with their friends, that can also be really frustrating. So I think that in terms of looking for mental health issues, it's important to look at both sides. One, for students who might be doing less than they were otherwise doing, than they were doing before, who are like dropping off from their activities. And in addition to that, students who are really like overexerting themselves, doing more than the average student by a large margin, and not necessarily getting like the results that they're seeing, and getting frustrated. And it's important to like notice like mental health issues on that end of the spectrum as well.
Those are great points, Carson. Our next question is, what are the main sources of stress for students at Stevenson? So maybe a student would want to take this question.
I can take this one. So I think like the main source of stress for students at Stevenson, like Carson mentioned, with kind of like the competitive nature at Stevenson, I feel like that is what drives a lot of mental health struggles and a lot of sources of stress, because there is this kind of atmosphere where students want to be the best and always achieve the best as well. So that can cause a lot of mental health struggles with like a lot of stress and just overburdening themselves with just a lot of work. So I think we see that a lot in terms of students getting involved in a lot of extracurriculars and they don't really know their limits in terms of how much they can actually handle. So I believe that is the main source of stress. And I think that just connecting back to the last question with how we can see that these students have these mental health struggles, it's also important to note that if like parents have concerns if their students are struggling through mental health illnesses, then they need to reach out to, their teachers or counselors because they're the ones who are seeing the students more often during the day. So that could definitely be kind of an indicator and a bigger help just to see how they can reach out to the student.
Yeah, awesome. So our next question is going to be, so from your perspective and knowledge about other students at Stevenson, does it seem like many students turn to substances to limit their stress and anxiety levels? And if so, how does that typically occur? And what are the main reasons that students in our grade levels justify using substances when dealing with their mental health issues?
I can take this one. Well, something that we really like to emphasize in Catalyst, and something that I think is really important is there's this big misconception that like all students at Stevenson use substances, or that this overwhelming majority of students turn to substances immediately for a variety of reasons. And that we like to emphasize is we know from statistics that we've taken from the Stevenson student population specifically, that the majority of students at Stevenson do not use substances, and that they have found other ways to cope with whatever they're going through. In terms of why students, of course, I acknowledge that I'm probably not the most reliable source for why students choose to use substances. But from what I've seen and from what I've heard, and knowing other Stevenson students that have struggled with those types of issues, normally I think it is kind of an approach for an escape, a specific emotion that they're trying to numb. A lot of times it's stress. A lot of times Stevenson students get, like Maham mentioned, into that really competitive nature of the school. And into AP classes and finals and testing, especially right around the end of the year, where we see students kind of, their workload is suddenly upped and they weren't expecting it. And they have all these stresses that are coming from school.
Thanks, Maya. We have another question. How can parents help their students if they are visibly stressed or anxious, like we talked about with school and life in general? So how can parents come alongside their students?
I would say that if a student is visibly stressed or anxious about school, one cause of that is probably that there is a lot of pressure at Stevenson to be taking the hardest classes, to be involved in a lot of extracurriculars, and that's probably the cause of the stress and the anxiety. If a freshman at Stevenson is taking all accelerated classes and they kind of just follow along on their academic path, by junior year, they could be taking 5 AP classes, 6 AP classes. And there are students who do that, but a lot of them are very stressed and anxious, and a lot of the time it's not worth it. And then there are students who that do it and like they just can't handle it, and it's like not the appropriate level for them at that point. So it's important to like as a parent, when something like this happens and you see a student who's overexerting themselves, being way too stressed, I would say the most important thing to do is to put less pressure on them, to not add any pressure. There's a lot of pressure at Stevenson, not only for classes and clubs, but also to follow particular paths when it comes to careers or to go to certain colleges. And there's all these pressures at Stevenson, and students have enough pressure at Stevenson to do all these things and to follow these traditional paths. But there's also over 100 clubs at Stevenson, and there are a lot of courses that are not AP courses. There are college prep level electives. There are courses in the fine arts department and the applied arts department that have GPA waivers even, which can take stress off of students. So there are a lot of these other paths that that parents can encourage their students to take. That's not the traditional, extremely stressful route at Stevenson. And I think by accepting that this might be the path that a student wants to take and encouraging them to find their passions, to take classes and pursue activities which are less stressful if that's what they want to do. I think that's really important because that can help to kind of like counter some of the stress that comes with just being a student at Stevenson, getting caught up with the culture of always excelling and always being at the top of your class. So I think that's something that is really important for parents to do, is just help your student find their passions, and don't put any additional stress on them beyond what they already might be facing at Stevenson.
I think this leads really nicely into the next question, which is some ways that we can deal with stress. You know, some ways that have definitely worked for me. You know, I just came from a tennis match like literally 10 minutes ago. So I can definitely say that, you know, this is something that I love doing and, you know, playing the sport. And I know a lot of people have different passions, but it really helps me take a step back and kind of acknowledge everything that I've done so far. And, you know, it really lets me kind of reflect on my experiences. And if I'm ever stressed out, I like to do the things that I enjoy, you know, like listen to music, go take a walk, you know, kind of study on some things that I might be lacking in. It really helps me kind of reflect and kind of resettle myself into a space that I can, you know, find myself, that I'm kind of settled and I'm back in my zone so that I can move forward. And these are some of the coping mechanisms that I have used. And if anyone else has any, you guys can also elaborate.
All right, if you think of any, feel free to share. We will keep rolling. Our next question is, from your knowledge, when do students most often use substances to deal with stress? Do you feel like it's social gatherings, like hangouts with friends, like big parties, alone by themselves? What's kind of the pulse?
I think there are different factors that weigh into when students choose to use substances, especially because there are so many reasons that students choose to use substances. When I like to think about why students make that choice, I often think about their friend group. And not that it has any direct correlation to if you're friends with a certain type of person, you'll choose to use substances. Ultimately, it is an individualized decision. But I find that friend groups where more people in the friend group choose to use substances and make that decision for themselves, someone is more likely to also fall into that trap and to be not necessarily peer pressured. I don't like to use the term peer pressure when I talk about Stevenson students, because ultimately that comes with the stigma of being excluded because you're not choosing to participate in a behavior. And honestly, I don't see that in Stevenson students very often. I think that a lot of Stevenson students respect others' decisions as long as you're not imparting like your will on their decisions. So as long as you're not passing judgment, I don't really see that. Aside from that, I think more towards the mental health front, students that are choosing to use substances to numb an emotion, normally they use those in isolation. And as far as like how frequently they use, I think that often it starts off not necessarily intending to become chronic use. And unfortunately, it does become that way because that the numbing feeling is so addictive, and because that's the desired intent, and it takes more and more every time, then students are kind of stuck in that cycle.
So our next question is there one substance that is more popular among students when they're trying to use it as a stress coping mechanism?
So if it's okay, can I answer that one based on my experience, like what I see as a pediatrician and in my practice? And then, you know, I think as students, you might have some opinions too, but what we see in pediatrics and kind of what we see in general, and the evidence shows us for teens, is that, you know, there might be some variation that occurs between younger teens in middle school, for example, versus early high school or later. And some of that was illustrated in the nice presentation and some of the data that you guys showed at the beginning of this program. But what happens is that the popularity of substances, and there's not really just one, the popularity is really influenced by things like marketing to teens, accessibility of different substances to teens in a community, and then also the perception of harm, because using substances always entails risk, and most who use, at least initially, are aware of that. So what we know too is when the perception of harm from a substance is low, then the use is likely to increase, and we've seen this over time. So kind kind of breaking that down into the most common substances that I see in my practice, particularly teens who are using or self-medicating for some sort of mental health concern, the top three are really, used to be alcohol, and then other things following. But what we see now is alcohol is probably still the most commonly used substance. Vaping nicotine, so not cigarettes, but vaping nicotine has really soared. And, what we saw from 2017 to 2019 was a doubling in the rates of use among teens. And then we got to 2020 with some incomplete data because of the pandemic, but vaping nicotine really holding high and steady at a very high rate, which was mentioned earlier, probably 35 to 40%. If you look at teens by the end of high school. So, we have the vaping nicotine, and that may be a little more common sometimes among younger teens, and that probably relates to access, and that probably also relates to this perception of it being just flavors, or this perception of it being safe, because of course teens have been subject to some really deceptive marketing when it comes to e-cigarette products. When it comes to alcohol, I think one of the things we have to think about, especially in this pandemic, is role modeling and what happens at home as parents. And, one of the things that teens may hear in their home are parents who come home and say, oh gosh, it was a rough day. I really need a drink. Or, they may comment to a friend, gosh, it sounds like you need a drink, or I need a drink to relax. And these are expressions that are kind of commonly used. But what it does is it really teaches this idea that this substance can be used to help reduce stress or anxiety, or to numb one from whatever that uncomfortable emotion or distressing feeling is. And then finally, we have to mention marijuana, because marijuana is something that there was a time where the perception of harm was high, the use was low, and with the legalization of marijuana across the country, we've seen an increase in this sense of harmlessness or perception of harmlessness. And with that has come more teen use. So, what we're seeing now, if we look at past year use among high schoolers, it's as high as just over 35%. Many are now vaping it, and the marijuana or cannabis that's being used has a very high concentration of THC, the psychoactive component. So it's a very strong, and in many ways a very different drug than it was in the past. It's absolutely an addictive drug. And about 1 in 6 users who begin in the teen years will actually become addicted to marijuana. So 1 in 6 teenagers, which is really dramatic. It is the most commonly used illicit drug in our country. And I think it's really important to understand that big tobacco is not just behind the vaping nicotine epidemic that we have, but big tobacco is really using the same strategies that created the vaping epidemic among teens so recently, along with their approach to getting teens hooked on marijuana in some cases. And it is absolutely associated with this idea of relaxing, reducing stress. I was with my own son driving on 294 just south of O'Hare about a week and a half ago. And there was a huge billboard for one of the local cannabis dispensaries, and it had 3 descriptors of cannabis. And the third descriptor at the bottom of the sign said cannabis is essential. So I don't know if anyone else has passed that, but giving messages like that, especially at this time, can really have an impact. So I think, those are the 3 that we're seeing. But I do see an increase as we have more recreational dispensaries in our communities. I am seeing a definite increase in the use of marijuana. And my expectation is that over the next few years, we'll probably see marijuana and alcohol at about the same level of use. Lastly, I just want to say, it's seldom that there's just one substance that teens are using. So I think it's important for parents to understand that oftentimes these substances, whether it's vaping and alcohol, whether it's marijuana, vaping and alcohol, they're used concomitantly, they're used at the same time. It's very rare that someone's choosing just one substance to use when they're trying to self-medicate for mental health concerns. And I'm wondering if the students kind of agree with my take. This is what I hear in confidential visits with patients.
I liked your comment about accessibility as well as kind of the message that we're sending in regards to perception of risk. I know that we're not doing Q&A until the end, but something I wanted to comment on quickly is someone asked prescription substance use as well. And I think the reason that, first of all, we don't see as much prescription substance use as we do cannabis and alcohol, especially. I think vaping is seen less than it is at maybe the older junior high level, the lower high school age level. I think when you start getting into upperclassmen in high school, they end up going for using alcohol and using cannabis. I find cannabis is more of, I don't love the term, but more of a party drug. And a lot of times people use them in groups just because it is commonly used by high schoolers in the form of edibles. And it takes a long time to actually take effect. So oftentimes they're made of like activities that revolve around cannabis use. That's seen less in isolation. I find that more, like we mentioned earlier, when they're trying to numb or self-medicate for a mental health concern, the go-to is usually alcohol. And that's, I think, due to the kind of common phrases that are used towards alcohol regarding self-medicating. Even if they're used by adults, it's really about the message. No matter how many times that message is said concurrently with, oh, you shouldn't drink because you're a teenager, or alcohol use is bad for you. I think the messages are sort of confused. And even when adults are modeling the behavior and they're using it to self-medicate themselves, even if that's not necessarily what's happening, when the message is delivered that way, that's the way it comes across. And also, I think that alcohol is so accessible to teenagers. I think it's the most accessible substance. And I think that a lot of teenagers would agree. It's easy to get your hands on, it's easy to get in excess, and a lot of times it's easy to get away with without people knowing that it's missing. So I think that's also a big factor.
Very good insights. So if parents were to find out that their student was using alcohol or took alcohol out of their liquor cabinet or using any type of substance, what would like initial steps be for parents? What could they do next?
Yeah, so I can take this one. So for the initial steps in terms of what parents should do is first take a step back and kind of initially understand the situation. So I think the main thing that you first need to understand is the root cause of why this is happening. So like we talked about earlier in this panel with mental health struggles and issues, maybe they're using it as a coping mechanism for their stress in school, or maybe they're being influenced by their peers. There can be many different root causes for why they are using substances, and taking a step back to kind of like analyze their behavior and see why this is actually happening is going to help you facilitate a conversation with them after kind of just understanding those root causes. And after understanding like those, the situation, like further researching the risks behind that specific substance and familiarizing yourself through reliable resources that can be provided through the child's school or just any other reliable resources is really important in terms of just knowing what the risk factors are behind those specific substances, because that essentially helps facilitate conversations as well. So when actually approaching the child and kind of starting that conversation, it's not great to kind of go in with like full force anger. I think that essentially makes it more uncomfortable, and it's not a great conversation that's going to kind of get through to the student. So creating a calming environment, which may be difficult, but it allows for the teen to open up more about it, because if the parent is angry at the student, then they're more likely to kind of just shut them away and kind of like not talk about it. So being more calm about it and kind of understanding why the teen is doing it in the first place helps for a more stable conversation. So I think that when you actually have like a conversation with the child, like when you understand like the situation and the risks, it helps you generate questions to ask the child, saying like, what's going on at school, like you know, what, like basically why they're doing it, and kind of just further understanding what you can do to help them, and how you can reach out to the school's resources or any other resources or help groups that can help is really important. So and I think just like consequences are definitely necessary, but they need to be appropriate. So after addressing the behavior, kind of bringing up those consequences is essential, just to ensure that they understand that the actions that they're doing is not okay, and just knowing that the risk factors behind them is that you're just trying to help them and trying to further understand what's going on in their lives. But if anyone else kind of wants to touch on any other steps parents should take, go ahead.
I think that was perfect. You know, that you could have my job. That's the advice that I give when this comes up and I get a phone call. And I, you know, the only thing that I would add is that, you know, we should remind parents who their resources are. And if you have a physician or a primary healthcare provider that you are connected with that takes care of your teen or your adolescent, that is absolutely a resource to you. And you know, some pediatricians have more understanding, some pediatricians have other specialists that they refer to, but your pediatrician or primary care clinician is absolutely going to be able to help point you in the right direction. We have excellent prevention counselors, as was mentioned, at our high school, and I highly recommend the resources that Dr. Cortese brings in her role at the school. And then the other thing that I mentioned to parents, because sometimes people feel very sensitive about the privacy aspect of this and dealing with this in the context of the family or with their student. And so I find as a physician that sometimes parents may be hesitant to approach a representative of the school or someone at the school. One, there should not be fear of doing that. The school is a great place and it's confidential, but many people through their work have something that are called employee assistant programs or EAPs, and that may not yet be familiar to the students on the panel, but those can be an excellent resource for parents who are also looking for some confidential support for themselves as they go through this process of addressing it with their kids. And of course, pediatricians are always more than happy to have a visit and a confidential conversation with someone's child, because some parents may feel like there is no way they're going to be able to be calm, even though they know that's the best thing to do. And so the process might need to start with someone else having that conversation with their adolescent.
Yeah, and kind of like furthering this question, I guess the next question is, like, for example, if a parent were to find their kid using substances and they wanted to reach out for someone for help, if the student uses substances as a stress coping mechanism, would the kid get in trouble with the authorities for using substances in the first place, or would there more so be actions taken to help the student address their needs? Because I know that is often a concern that many students and parents have when addressing these issues. So if anyone wanted to take that, feel free.
You know, I'm happy just to add that, again, what I see with experience is if the discovery that a teen is using doesn't come through some interaction with authorities, there really isn't a way that authorities would be involved. And I am definitely not a legal expert, but what I can tell you is, organizations like the American Academy of Pediatrics and other organizations that advocate for youth, there's this movement and this process where we've moved, and this has happened in many of our local governments too, we're moving to a place of really decriminalizing some of these substance uses and decriminalizing the idea of teens using them, and trying to move more toward a place of really supporting rehabilitation or help to reduce that risk of addiction and ongoing substance use. So, for example, we've seen this in our own community with cannabis in particular, where the fines for possession are really about the same dollar amount as like speeding tickets in communities. So I think the expectation that there would be trouble with authorities is probably very limited, unless this were something that was taking place, for example, on school grounds, and that's how it was discovered, or as part of some other activity that was in violation of laws. I also want to add one thing. I think we have to think about moving to a place where we're holding culpable the individuals and the businesses that are selling these substances to teens, as opposed to directing that sort of trouble that you're asking about, or the violation or the sort of punishment or fines, directing that at the teens and adolescents who are using. So a little bit off topic, but I think it's important that we reorient our thinking and really remember that teens are the victims sometimes as far as this process of initiating use of substances.
Yeah, those are really good insights. So we did discuss some resources available to parents and students who may be using. Are there any other specifically at Stevenson that any of you would like to highlight? Or even I know we have a couple middle school parents, things that they might be able to find within the school system?
So specifically at Stevenson, we have Dr. Cortese, our substance prevention coordinator, and she's also our Catalyst sponsor. So she's available at Stevenson, where she can connect parents to more resources. And she also has a Calendly link and drop-in office hours. So that's on the d125.org website. So you can find all that information there. But another resource at Stevenson is the Student Assistance Program. So that helps support and provides assistance to develop a plan to help students and families that to aid students who are struggling with substance abuse related issues. But just to kind of go on like a little bit of a tangent to kind of connect to a previous question with just kind of how to cope with mental health, stress, anxiety at Stevenson, I think that can definitely be a root cause of why students have or struggle with substance abuse related issues in the first place. And I guess the best thing that I've seen to cope with stress and anxiety is kind of just like organizational skills and being able to find a time to just take time away from school and to not think about it. So something I personally do to relieve my stress is I journal. So that's definitely something that I recommend to anyone. It helps you like pour out your thoughts and definitely helps me relieve my stress. So finding that one activity where you're kind of just not thinking about school, but instead just kind of reflecting on a lot of what has happened in your day, what is making you feel those different emotions, that can definitely help with those mental health struggles. And I think that just connects back to substance abuse related issues. And essentially those are what can help the student kind of overcome those struggles, because the student assistant program can use those different activities in their plan to help the student and the family overcome the struggle and kind of move towards just a better life in general.
Yeah, so our next question is, what would prove effective at discerning students from the idea that mental health struggles can be solved with substance use?
I would say that overall, we do a pretty good job as Stand Strong and as Catalyst sharing information about the effects of substances on teens. Dr. Sirota mentioned earlier that 1 in 6 teens who use cannabis can become addicted to cannabis, do get addicted to cannabis on average. And we have a lot of platforms through which we share information like that with teens. So every person that goes through Stevenson, every student will take health at some point. Most take it while they're a sophomore, and they have a whole unit on substances and the effects of substances. Catalyst also has a lot of events for students, and Stand Strong has their own events and resources as well. So we do a good job from that perspective, sharing information about the effects of substances. And when we share this information with students, they definitely do think about it. So if you take that one fact that 1 in 6 students who use cannabis will become addicted to cannabis, I think that any student will understand that if they do fall within that 1 in 6 and they do become addicted to cannabis, well, that's certainly not going to solve their mental health issues. But a lot of students still think that substances can be a good coping mechanism to deal with mental health issues. And if they fall within that 5 and 6, maybe there won't be much of an effect of using substances. But I want to connect that back to what I was talking about earlier with that there are kind of two causes of mental health issues. One is a student who's very demotivated from their activities. These are kind of like the effects of depression or of mental health issues where you're not doing a whole lot. You don't really have activities that you're committed to. You're not really into athletics. You're very demotivated in your classes. And the other side of it is the student who is very motivated, who is doing a lot of extracurriculars and a lot of difficult classes, and they're very stressed out. And both of these students might turn to substances. And I think the other half of the information that we like to share and that parents should also push out to students is that it's finding these activities and like being content with the activities and enjoying like all your academic commitments that you do. That is the real the real solution to mental health issues in the long run, is finding that equilibrium. Students turn to substances when they're very demotivated or when they have a lot of stress to calm them down, like in the short run, to calm them down on that particular day. But if a student finds the balance that they're looking for, if they find activities and classes that they're very passionate about, and they're not too overwhelmed by that activity, if you find that equilibrium point, there's really no need for that student to turn to substances, and they'll realize on their own that that is really the solution to mental health issues in the long run, is finding that balance. So kind of to summarize, the first piece of information that we share with students is that there are a lot of possible negative effects of mental health issues. So that's kind of, a lot of negative effects of using substances that can lead to mental health issues. So when we share information like that, students see that, no, we don't believe that substances can solve mental health issues, and a proportion of students might become addicted to substances if they use them. But then they might think about like, okay, what if I don't become addicted? So students might still think that it could be like a short-term solution to their mental health issues. So then it's a matter of providing students with an actual solution to their mental health issues, in addition to just refuting the idea that substances can be a good solution to mental health issues. So it's helping them find that balance in their activities, helping them find their passion, and putting them on the right track instead of just telling them to avoid the wrong track. That's really the best way, is not just giving them that warning, but giving them encouragement to get on the right path.
That's great. And to go along with that, what are factors that prompt the idea that like substance use can solve mental health issues? Like, are there any contributing factors that you guys have noticed among students?
I definitely think word of mouth has a lot to do with it. You hear teenagers fairly often make jokes about substance use. Whether the intent is, malicious or not, I think that regardless of whether they're being necessarily serious, it does perpetuate the stigma. As well as I think that we've touched on this a few times, but I really like the point about parents say like slipping up and saying like, oh, I need a drink just because I'm stressed. it's really about messaging, and something that we like to emphasize to parents. Obviously, Catalyst works a lot with students, and a lot with Stevenson population specifically, but the clear expectation of parents that their student should not use substances is really important. And I think a lot of times parents can get discouraged because they feel like, oh, my teen's not listening to me, which in all honesty is not untrue, but they're listening to you more than you think that they are. And the messages that you're sending, even as they get older, are really important. And a student that, this is, by the way, this has been proven, I'm not making this up, I promise, but a student that has received messaging from their family that drinking is not an acceptable way to manage stress, and that using substances is, refraining from using substances as an expectation, they're less likely to actually be enticed to try it, or be enticed to kind of fall into that trap.
And maybe just to add, not only has it been proven, you know, on a larger scale, we know that messaging works for prevention, but we see that in the information that comes from students out of the surveys we do in our own school population. We see that messaging is very important in abstaining from use.
Yeah, so our next question is going to be, what is the best way to make a child feel comfortable when admitting that they do have a substance use problem to their parents? So how can parents go about dealing with that and just having those tougher conversations with their students?
Should I start with maybe what I recommend, or do we want a student to go first?
I think maybe we could have a student go first and then transition over to what you think with your experience.
I can start. So I think that the most important thing is just the mindset that you would have as a parent before the student even brings up to you that they might have an issue with substance use. They should know that if they report a substance use issue to you, if they're struggling with it, that you'll really view it as more as like a concern about their mental health because you care about them. And it's not something that you necessarily want to punish them for, but it's something that you do care about because you care about them, and you view it as like a mental health concern that that needs to be addressed, but that you want to help them address like in a constructive way. I think that could make the student more comfortable sharing that substance use concern with you if they know that you're there to help them deal with it, to help them navigate it. Because at this point, clearly, it's not an issue that they want to be having. It's something that they're trying to navigate and get through, and they're trying to get back on track at this time when they're actually telling you about the substance use issue that they're dealing with. So I think it's important that you're on the same page as them, that you are also trying to navigate it with them, trying to help them get back on their normal footing, back not focused on substances, but focused on classes and activities. So I think it's just important that they know that you have this mindset in the first place, and that really you can let them know that you have this mindset just by consistently just like viewing substances as a mental health issue, and something that like your student should know that it's something that you're concerned about, substance use. But you should never like share with them like fear tactics, or really just like criticize students who use substances or shame students who use substances for it, because that's not really viewing it as a mental health issue, really, that is like something that is navigated. Those are kind of like outdated ways of looking at substances, and nowadays it's more about just viewing it as like a mental health concern that we have to navigate together.
You, Carson, have articulated just about everything I would have said, I think, and this is really another way of saying the message you just delivered, that I think as an adult or as a parent or the guardian of a student, you just need to make it so clear that you're coming from this place of love and concern, and only want the best health for your child or for the student, and that you're really committed to helping them. And that is a very different message than a lecture, than a punitive message, but it is the only sort of starting point that's probably going to be effective. So it takes maintaining a sense of calm, and that can be hard to do. It takes not being judgmental, and that can be hard to do. And I think the other thing that can be very helpful is like having a conversation goal, because this might not just be a one-time conversation, and hopefully, in fact, it won't. So having a goal for where you might like to see each conversation or discussion lead. And if you can kind of repeatedly give this message that you're committed to helping your teen, that you're going to help them learn other ways to relax, to manage their stress, that you will help them find that care that they need. And so they really won't have to rely on substances to manage their mental health or to be able to relax. That's something that can be very comforting to an adolescent. And then I just also think it's helpful to be future-minded when you talk about this. So it's a little bit to what you were saying, Carson, about like helping that individual get kind of back on the right path or put them on the right track, and to not have such a focus on how could you do this and what did you do and you're going to ruin your life and this is something you should never do. That's really not what teens need to hear, and they really need to understand that you're invested in their future. You have a commitment to help them to get to a healthy place, and then you're going to figure this out together as far as how to get there, because teamwork it is always going to be beneficial. And then I just want to frame this in the context of, during this pandemic, I mean, it is remarkable and shocking to us as pediatricians how much anxiety in particular, but now we're starting to see some depressed mood too, but how much anxiety we are seeing in every age. That is the impact of COVID-19 for the most part on kids and teens. It's not so much a respiratory disease that we're seeing. And so I think more than ever, this is a good time for families to kind of reorient themselves and to say, if we haven't worked together as a family, or we haven't had it be our plan as a family to help our teens find ways to develop healthy coping strategies, and to really role model that ourselves as adults, that we're missing a very important opportunity. So this is something that will continue. We're not quite anywhere near the end of this pandemic. And so committing to that and understanding how very much this disease is impacting mental health can lead to a lot of prevention of substance use within families.
That's such an important insight, Dr. Sirota, and we're getting some great questions from our Facebook chat. So parents and community members, please feel free to continue to write those. One of them actually had to do with COVID. One question says, how much do you believe COVID has impacted students' mental health? So maybe if a student wants to share a perspective just from your peers. And then is there anything particular that students have been worried about?
I think a lot has happened in the past year, aside from just COVID-19. Obviously, we have racial justice issues being brought to the forefront of discussion. We have a lot of legal action that's being taken around that. And it sparked a lot of interest in students, I think, aside from that, and also in the medical industry. And as well as mental health. I think mental health is becoming more of a discussion, especially at Stevenson. We have a lot more events around mental health now, just because it's becoming such a big issue. And not that it wasn't always a big issue that impacted Stevenson students specifically, it has. But I think it's more clear now that students, at least until recently, have been stuck in their houses. And I think the division between home life and school life has become so blurred that I think a lot of anxiety is resulting from there's no way to get away from either of those things. And a lot of times one or both of those worlds is stressful for students in itself. And the other being so separated from that has become sort of an escape and a coping mechanism all on its own. And then you throw high schoolers in their bedrooms for 12 hours a day and you say, this is where you're going to do school now and where you're going to eat and where you're going to sleep, and kind of everything is up in their bedroom. And then you have families saying like, oh, we want to spend time with you too, which is a great thing. But it's hard to find out how to manage all of those worlds when they're suddenly like all together.
Anything else to add? All right, going along those lines, a parent asks, how can I help my student manage his mental health when his AP classes, extracurriculars get really busy, but he doesn't want to decrease the workload? Are there other strategies that have worked for you guys? I know, Maham, you mentioned journaling. Any other strategies? I know you are all very, very busy students as well, very involved. So any strategies that worked for you personally?
I think it has a lot to do with course planning just before you go into the next year. So I think that just kind of considering in the context of the extracurriculars that I'm doing, as well as how much I think I can handle, that's how I essentially like plan my courses. So I think that it also has a lot to do with just like specific interests. So I feel like I didn't take some classes in high school because it wasn't related to my interests. So for example, I took more social science classes because I was more interested in that topic. And that motivated me more to do work in that specific course area in comparison to a different area of interest. So I think it really has to do with just prior to the year of going into like just a new year. I know like for like freshmen, sophomores, and juniors, you have a lot of time to think about what you want your course path to be and how you want to kind of just what you want to learn and what you want to see how your interests play out. I think that has that plays a really big factor. So I guess my biggest advice with that is kind of, it takes a lot of time to just kind of think about like what you're interested in, and essentially like even if like a student does not want to decrease the amount of workload that they want to do, they have to at least want to be or be motivated to do it and know that it's going to benefit them. And I think like the best way also is to also just like make like a pros cons list, or kind of group specific classes into interests and see if those classes will benefit them in the long run.
Kind of to add on to that idea of planning your year, I would also say it's really important to plan your week out in advance and plan even your day out in advance. To start with the day idea, I think that like students should have some free time every day. They should have some time every day where they're not working on something. And there are students who might be working on classes and clubs from when school starts in the morning until 10 at night, and then they go to bed and wake up the next day and start working on that stuff again. And I think that when people have days like that over and over and over, it gets fatiguing and it causes stress and anxiety. And that's not like a healthy schedule. Students need some downtime. So one thing that I try to do is try to just avoid just wasted time. And when I say wasted time, I don't mean like watching TV or doing something that you enjoy just to relax. Like I don't think that's wasted time, because that's necessary time to de-stress. I think that students need to cut out the amount of time that they spend after they've been working for hours, just like staring at a homework assignment, not really making any progress, just getting frustrated with it. And they can't do it, not because they're not capable, but because they've been working for hours and they're getting anxious and they need a break. So one thing that I do, like sometimes like a couple times a week, is if it's getting late at night, if it's around 10 p.m. and I'm getting tired and I notice that I'm less productive than I normally am and I'm trying to be productive, I'll just go to bed. And instead of waking up at 8 o'clock for school, I'll wake up at 7 o'clock. I'll wake up at 6:30. I'll wake up at 6 if I have to, and I'll complete my homework in the morning. And ultimately, that'll give me more downtime. I'll complete my homework, my extracurricular work in less time, and I'll have more time just to not be focused on that. because I've cut out that time that I spend just staring at a homework assignment, not really doing anything. And I think that if you do that, not only planning out your day, but also planning out your week, trying to find enough time to be productive on Monday through Friday. I think it's important to take time off on weekends just to de-stress, have time when you're not working on anything, not thinking about work. And a good way to do that is just to maybe after school on Friday, spend a couple hours working, get a lot of your homework done. And then Friday night, Saturday night, Sunday morning, you're not even thinking about that homework. A lot of students will do their homework on Sunday night or on Sunday afternoon. And when you put it off like that, you're thinking about that homework all weekend, it's on your mind. But if you can just put in a couple more hours of work after school on Friday, if you have the energy to do that, you can have your mind completely free from school, from clubs over the weekend. So I think just structuring your day and your week appropriately is very important.
Yeah, so I think that is a great place to end it off. Thank you everyone for your great insight. Yeah, so once again, we'd like to thank you all for joining us today. We hope that this was a really valuable experience for you all to hear from our parent committee at the beginning of the event, and then also from all of today's wonderful panelists. If you guys have any more questions that you weren't able to get answered specifically today, we've listed the email of Dr. Cortese, who, like Maha mentioned, is our substance use prevention coordinator at Stevenson and the co-sponsor, one of the co-sponsors of Catalyst. And we also gave the email of Dr. Sirota, who, as you guys all must have realized today, was an extremely valuable resource that we were able to hear from today. So additionally, we've also linked or given the website URL for the Catalyst and Stand Strong websites to learn more and stay up to date with like the happenings in our respective coalitions. And lastly, we've compiled a list of resources that we believe would be extremely valuable and helpful for all parents. So if you'd like access to those, simply scan the QR code that's on the screen, and that should take you directly to a page with all the resources that we compiled. So once again, we truly appreciate you all for joining us today and taking time out of your very busy schedules to listen in on this important discussion. And we look forward to seeing you all at future Catalyst and Stand Strong events. So that's pretty much all we have for today. I'll leave this screen up for a little bit longer in case you wanted to maybe take a picture of it or scan the QR code. But if not, then we wish you all a good night. Thanks, everyone.